everybody. Today I want to talk to you about acceptance and commitment therapy, or ACT. ACT is similar to cognitive behavioral therapy, which is what Amanda talked about in her video last week. And if you haven't checked that out, please go to our Water's Edge Counseling Facebook page or Instagram and watch that video. It's really helpful and informative. ACT is used commonly with clients, and it can be used to help treat anything from depression to work-related stress to social anxiety. The list goes on. The main concepts of ACT are acceptance and commitment. But we start by first acknowledging what our reality is. I think we can all probably identify a time in our life when we were avoiding or denying a specific feeling or circumstance or struggle or past experience that we did not want to deal with. And so ACT first encourages the client to stop avoiding and denying and to acknowledge the reality for what it is. The thought process is the further that we distance ourselves from our problem, the further we're distancing ourselves from the solution. So we first acknowledge the reality of what it is that we're dealing with. And like I said, that can be an emotion, it can be a specific circumstance, a past experience, a personal struggle, or a lot of the time it's several of those things combined. Once we acknowledge the problem, then we determine whether or not change is possible. And if change is not really possible, then we have to learn to come to a healthy level of acceptance with this problem and learn how to move forward with our life in spite of this problem and not continue to allow this problem to have so much power over us and, how I like to say, run the show. So with acceptance, we're learning how to say, this is part of my reality and that's not going to change. And so I need to learn how to accept that and move forward in a healthy way and not give this thing so much power. If change is possible, then we talk about, what does that change look like? What do I have control over in this? And then we commit to specific actions to get the client to where they want to be. Another part of ACT is strengthening the client's own inner dialogue or self-talk. And this requires the client to really pay attention to, in the moment, what their thoughts and feelings are towards the problem. If we're avoiding or denying the problem itself, then we're probably getting pretty overwhelmed because we're not paying attention to what's going on with us. We're just kind of letting the problem take over. So when we stop and use what we call mindfulness and learn how to be really present in the moment and pay close attention to, what am I feeling right now? What am I thinking about this problem? Then we can more effectively change those thoughts and feel more in control of our feelings. And I think the most powerful benefit to strengthening a client's self-talk and inner dialogue is that they feel empowered to then really be able to process their problems and deal with them more effectively on their own. And that is the ultimate goal. So if you find yourself avoiding or denying a problem in your life, a feeling, a circumstance, please reach out to Water's Edge Counseling today. These are concepts that we as therapists use with our clients on a daily basis, and we are ready and willing to help you to first acknowledge your reality and then learn how to deal with it more effectively so that you can feel more in control of your life. Thanks for watching.